prepared by and organized by the United Nations Statistics Division, primarily my colleague, Mr. Seife Tadesse, who is the focal point for population housing censuses in the UN Statistics Division. Allow me just to go very shortly through the program of work and to provide some introductory remarks. The side event will have two distinct components. The first component would be reporting on the work that has been done by the members of the International Census Coordination Committee, primarily the UN Statistics Division, UNFPA, and the UN Bureau of Census, the international program of the UN Bureau of Census. That will then be followed by the presentations from our colleagues and distinguished colleagues from Chile, Ghana, Oman, and Portugal, primarily focusing on conducting the population housing census in times of the COVID-19 pandemic. Allow me also to emphasize that this side event is a part of the, as I've said, 53rd session on the Statistical Commission, and that the topic on population housing census is more precisely on the implementation of the 2020 World Programme on Population Housing Censuses will be discussed during the Commission. The whole Commission, given the circumstances, will be virtual, will be online, and so are all of the side events that we have prepared and our colleagues from other institutions as well to be presented during the week preceding the Commission and a week after the Commission itself. There will be no side events during next week, simply because of the sessions of the Statistical Commission. So this side event is so designed in order to contribute to the discussion at the UN Statistical Commission from the point of view of two major issues. The first issue is how to conduct the census during the pandemic and what are the difficulties that a number of countries are now facing. And the second point is to prepare for the future, to have a kind of preparatory approach in terms of putting together some of the instruments that we believe would be instrumental for the census taking in the future. So this is how we have designed this event, and this is how the paper, the report of the Secretary General to the Statistical Commission already looks at these two major components. So we will start the presentations by UNSD, then it will be followed by UNFPA, and after that the UN Census Bureau International Program. From the side of UNSD, I would like now to give the floor to Ms. Meriam Demirci, who is the Interregional Advisor for Population Housing Censuses at the UN Statistics Division. Meriam, please go ahead, you have the floor.
Thank you, Sergeant. Yeah, I hope you can see the presentation slides.
Yes, go ahead.
Yeah, all right, okay. Thank you. Good morning, good afternoon, and good evening, all the colleagues, depending on where you are. Now that we will in this presentation, I will try to briefly explain what we have done since the last Statistical Commission on the 2020 World Population Housing Census Program. Our focus will be also our activities on the impact of the COVID-19 pandemic. Let me start with the very brief note on the World Program. As you all know, the program was endorsed in 2015 by the Economic and Social Council of the United Nations. Since then, now the 7 years already passed, and we have only 3 years to complete this round of the census. This resolution mandates UNSD to prepare to develop the guidelines, revise the international guidelines on censuses, coordinate the census activities among the stakeholders in assisting the member states to plan and carry out censuses. And also we regularly monitor and report the census activities to the Statistical Commission. And also, depending on the request, we provide the technical assistance to countries in conducting censuses. This is the list of the international guidelines on the censuses. This is developed by the UNSD in collaboration with the other international organizations and member states. As you all know, the principle and recommendations for censuses and handbook on census management were revised at the beginning of this round, and now is available in French. So these two guidelines are available on our website in French language. This was translated actually with the support of our colleagues from UNFPA. We have also the other guidelines. This is the list. I will not go in detail for each the guidelines, but just want to mention that we also revised the handbook on census editing. The technical report on post-enumeration survey is still accurate, so we didn't make any revisions. But also we produced 4 new guidelines during this round. Handbook on measuring international migration through censuses. We have guidelines on the use of electronic data collection technologies in censuses. We have another new technical document on measuring SDG indicators through population housing census and CRVS data. And finally, this year, we drafted the new handbook on register-based population housing censuses. So this is the link that you can reach all these documents. Few more words about the new handbook, which is the title is Register-Based Population Housing Censuses. So this handbook aims to assist countries that planning to change their census methodology from traditional census to other approaches involving the use of administrative registers. This handbook has been developed based on the international guidelines, particularly produced by the Economic Commission for Europe. But we also, in this document, we also included the country experiences from other regions. There are several chapters, 5 chapters in this document. One basically focusing on the necessary preconditions that all countries should meet before planning this transition. Another chapter discusses the types of administrative data sources, basically base registers and specialized registers. And we also discuss what would be the content of these registers. Another chapter, extensively discussing how to transform administrative data into census data. So the handbook clearly distinguishes between the administrative register and statistical registers. In that context, we discuss also in this document how to create a statistical population register, maybe based on the census data. So you will see really extensive discussion on this issue. And also we discuss how to construct integrated statistical registers for census information. Another chapter discusses the quality assessment. So there are several dimensions to measure the quality. We discussed the how to measure the source quality, input data quality, process quality, and output quality. You will see that in that chapter, we also have discussed the tools and also indicators that can be used to quantify the assessment of this quality. We organized an expert group meeting in December last year to discuss the first draft of the handbook. About 75 experts from 21 countries and also international organizations and regional organizations participated this meeting, and they provided their comments and suggestions. After the experts group meeting, we revised this handbook. The second revision was submitted to the 53rd session of the Statistical Commission, and you can find this document and that link. In terms of the monitoring and documenting the impact of the COVID-19 pandemic on the implementation of 2020 round of censuses, after the arrival of pandemic, we conducted the 3 surveys. And then last year, we developed this dashboard, the Census Dashboard, using this survey data. You can find this in this dashboard, you can find that what countries were able to conduct the census during the pandemic, if they postponed, when they are planning to conduct the census. And also you can find a detailed more information about each country in the second part of this dashboard. You can find that the information about each country, whether the pandemic affected the census operation, whether they postponed census enumeration and the preparatory activities, and what were the main challenges to conduct the census during the pandemic. This dashboard will be updated soon, and with the inclusion of the countries that they are planning to conduct census this year. We also summarized the result of the survey and this dashboard in the UNDESA policy brief. This was produced last year. And also this main objective of producing this policy brief is to increase the awareness on the impact of the pandemic. And also this brief provides some messages, important messages. One of the messages that the national authorities should remain committed to conduct the census during this round, of course, depending on their national circumstances. And also the policy brief highlighted that the postponing census activities because of the pandemic would have an impact on the data availability, of course, for small geographical areas. And this will also adverse impact on assessing the effect of the national development policies because of the lack of data for small geographical areas and small population groups. Another activity that we conducted last year is the expert group meeting on the impact of the pandemic. We conducted 2 expert group meetings in last year in February and November. More than 200 people from over 40 countries participated in this workshop and made the presentations on their experiences. Main objective was to monitor and document the challenges in conducting censuses during the pandemic. Also, there was the extensive discussion on the alternative solutions in designing the census operation to reduce the impact of the pandemic. We also discussed the effect of the pandemic on data quality and the census measurements. All country presentations and conclusions and recommendations of this meeting are available online at the UNSD website. I just want to mention few of the points, conclusions of this meeting. The majority of the countries had to modify or plan to modify the census procedure, particularly the planning to introduce new data collection modes. Basically, the online questionnaire, computer-assisted web interview, telephone interview, and paper-based self-interview. Main objective is, of course, to reduce the face-to-face interviews. Another observation from this expert group is that because of modification in census procedures and also introducing the new procedures to minimize the adverse impact of the pandemic, for example, procurement of the personal protection equipment and also organizing the online training program increase the census cost. Another important observation was that the conducting census under the pressure of the pandemic can have created a concern in terms of the data quality. Mainly the concept of the usual residence may prove ambitious for certain population groups, particularly people living in institutional places because of the lockdowns and the travel constraints. Another observation was, a concern was that the non-response might be increased because of the reluctant, for some people, reluctant to participate the census because of the pandemic conditions. And it might be difficult to reach people, homeless, and also people living in the compounds and remote areas. Another observation is related to its impact on the census results. We discussed in the meeting that some census topics might be affected, particularly the population distribution, mortality indicators, migration, employment, and also unemployment might be affected by the pandemic conditions. And these indicators may show some different patterns or levels. Although what extent the pandemic will affect these census measures are not are unclear, but still there is a suggestions that when we analyze the census data, we need to give attention to its impacts, possible impacts on the census measures. We also organized the workshop for French-speaking African countries on the census, the census methodologies, and also the impact of the pandemic. We organized this event in collaboration with the Economic Commission for Africa at the last week of January. More than 100 people, 150 people participated. And also we have produced a conclusion and recommendations of the workshop for French-speaking African countries. It was observed in this meeting, that workshop, that many countries actually in the region had to postpone their census operation at least once. Another observation is really important, very important, that even before the pandemic, actually a number of countries are facing challenges to conduct the census, mainly because of the financial constraints and political instability. Number of countries also in the region successfully use the tablets to collect the data, and also almost all other countries actually planning to use copy, and also they're planning to use GIS technology for producing census maps, and also monitoring the field enumeration and dissemination of the census results. They are also either collected or planning to collect the GPS location information at the building level. Finally, I would like to finish my presentations on our focus areas for this year. We will continue monitoring and documenting the impact of the pandemic on census and its impact on the data quality. We will update the second draft of the handbook on register-based censuses. This will be the live document. We will include some country case studies in this handbook, particularly to provide the country experiences on specific issues, specific challenges. We are also planning to organize a regional workshop on this to introduce this handbook, and also the evaluation of the quality of census data and dissemination. Depending on the request, we will also provide the technical assistance to countries. And finally, we will continue coordinating the census-related activities together with the UNFPA, the US Census Bureau, and also the World Bank through the International Commission on Census Coordination. Thank you.
Thank you very much.
It's over to you.
Thank you, Miriam. Thank you very much for this presentation. We will have some time for perhaps discussion and some questions after we hear from the other two presenters, primarily on the work of UNFPA in the 2020 census round. It will be presented by Mr. Tapiva Jamba, who is a technical advisor at UNFPA New York. Tapiva, please take the floor.
Okay, thank you. Okay, let me try and share my screen. Okay, can you see my screen?
Yes, Tapiwa, everything is fine. Please go ahead.
Okay, great. Thank you. All right, so I will just highlight, I think, some of the support that UNFPA is providing, but to contextualize that, okay. So just to contextualize that, a quick look at the context, I mean, of the 2020 census round. I mean, there are a number of issues, the new demands for data, the use of new technologies across the board, new data governance needs related to the finer, the collection of the finer details on geolocation, for example. Many countries also still facing funding challenges, but and as well as capacity gaps. In addition to all this, we then have the impact of COVID. So I will just look at that a little bit, focusing on the UNFPA program countries. These are countries where UNFPA is providing census support. Just to give an idea of the scope of the impact of COVID. If we look at the graph here, we had, out of our program countries in 2020, this is pre-COVID, we expected 49 countries to have census enumeration in 2020 and 34 program countries to enumerate in 2021, and then going down like that. But then when COVID came, the situation actually changed, and what we have from our program countries is that only 11 program countries were able to enumerate in 2020, and 10 were able to do so in 2021. So the bulk have shifted the dates. Now we have 60 of our program countries scheduled to enumerate in 2022. And 2023, we have 20, and goes on like that. And we still have a couple. We still have a number of countries that either did not have a date even before COVID, or postponed due to COVID and have not yet set a new date. So this is just to show that how COVID has shifted the timelines for census undertaking across the globe, really. Okay, so this is just a quick visualization of what has happened in terms of countries that have already collected, enumerated, as well as countries that are coming up. The red and the browns on the map highlight countries with censuses that are expected in 2022 and 2023, as well as 2024. The deeper red is the immediate ones, that is 2022, and then you're moving to 2023 and 2024. So there's still a lot of censuses that are yet to happen as part of the 2020 census round, and we only have 3, 2022 to 2024, to complete that round. So there's a lot of work, as we can see. So moving, circling back to UNFPA support, this is based on our strategy for the entire 2020 census round, which was really supporting the modernization of censuses, and looking at different dimensions of modernization, use of handheld devices. We are looking at digital cartography, use of satellite imagery, also use of mixed methods, as well as use of GIS to improve census quality, increased use of GIS in census analysis and census dissemination, and generally a wider use of census data to meet various needs for indicators and other related development frameworks. And also through our partnership with in Grid 3, we are also supporting countries that are not able to enumerate certain parts of the country to generate fairly reliable estimates of population to fill that data gap. Again, okay, this is just one slide to talk about the modeling of the population modeling and the generation of the estimates. So giving three different examples, but I wanted to just focus on the Burkina Faso example, which is where Burkina Faso, they just did the census in 2019. They were able to send enumerators to most of the country, but they had a number of municipalities where it was too insecure to send enumerators. And so we worked with the NSO, we supported the NSO to generate estimates in partnership with WorldPop. So in other words, for areas where they couldn't go, they then were able to generate the estimates of the population distribution, population by age and by sex, of course, with the limitation that there are no other accompanying numbers to come with that. But we also have the same approach being used, for example, in South Sudan. South Sudan, they are preparing for a census, but they've not had a census since independence, and there's been a lot of population movement. So NBS was interested in generating an estimation of the distribution of the population to use the data for now, but also to use the data to prepare for their upcoming population and housing census. So I will focus a little bit I will focus on the type of support that we are giving in terms of strengthening national capacities to use census data. As I've shown in my earlier slides, we do have the challenge of COVID, but amidst the COVID, a number of countries have managed to conduct census enumeration, and they are now at analysis stage, where they are looking now to analyze and use that the census data. So I will just focus a little bit on the type of work that we are doing to support countries to analyze and to use census data for development purposes. Well, the first, the part of the basic approach is to enhance, or is to enhance or to communicate the census results is through visualization. Just basic visualization of indicators. I think the old saying is that the picture says 1,000 words. So if those countries that are already have census data are able to use visualizations, this will go a long way to communicate the findings of the census to policymakers, but also to the general public in the countries. In this case, in this example, this is visualizing child marriage data. It comes from an older census for Zambia, their 2010 census, the census that they conducted in 2010, but the approach will remain the same in terms of how you can use visualization methods to communicate census results in a more effective and efficient way. The next, here we are showing a mapping of population vulnerabilities related to COVID-19 based on census data, looking at, for example, distributions of population of older persons, looking at access to piped water in the house, looking at a number of persons per room in terms of population density at household level. And this mapping can be done at a regional level, but also you can do this at the sub-national level, depending on the availability of the your data at a sub-national level. Next, I will show using census data, combining census data with survey data to estimate indicators at small area level. This is through use of small area estimation methods. So we are doing quite a bit of work on how to combine census data and, for example, DHS data or mixed data to generate high resolution data on some of the key SDG indicators. In this example, this is Nepal, generating at municipal level SDG indicator 3.7.1, which is proportion of demand for modern contraception satisfied, the proportion of demand for contraception satisfied with modern methods. So there's a lot of scope in it. This is part of the focus on expanding the use of census data to meet development needs. Then this is part of the work we just started with Malawi, using their census data also to map access to essential services. This is combining data from the census with either geospatial data, in this case, data on the location of health facilities, and also data where the health facility attributes are also collected. Combining this with the population distribution to actually map population access to essential services. From our perspective, we are looking at mapping access to sexual and reproductive health services, but these approaches can be used to map access to any other services of interest. And then this is an example showing combining population distribution with climate change vulnerability mapping to determine proportion of the population at risk of suffering from, for example, floods and flooding, as well as landslides. We are also aware of the potential to leverage census data to strengthen other population components of population data systems, including, for example, civil registration. Also looking at using census data to produce common operational data sets on population statistics, which are data sets needed for humanitarian response and humanitarian preparedness. Also, use of population data for population projections, as you can imagine. Now, just to get towards the end, this is UNFPA capacity strengthening. This is some of our approaches to strengthening national capacities for census. We do produce periodic briefs and guidance notes targeting specific topics. We are also working on e-learning modules. We have 3 that are upcoming. One is on register-based census, which is really just gives an overview of, what register-based census is all about, what is required, and to help countries to figure out if this is something that they are able to pursue or not. And then we do also hold periodic webinars, regional or global, as well as providing targeted country support. I think, as you are aware, we have chief technical advisors on census that are attached to several NSOs to support census processes, but we also do provide specialized expertise, organize expert missions, and provide other technical and operational administrative support, as well as promote South-to-South and triangular cooperation for census. Thank you very much.
Thank you, Takiwa. Thank you, UNFPA, for this presentation that is really comprehensive and detailed activities that UNFPA is undertaking to support the national census taking in a number of countries where they have the representation. Just for the sake of all our colleagues to elaborate on the division of labor that we have between UN Statistics Division and the UNFPA. The UN Statistics Division is primarily mandated with developing the methodological framework for population housing censuses, while our colleagues in UFPA, which is an implementation agency, are able to implement them at the national level, and that is where the synergy is coming from. So thank you very much, Tapiva. Let us now move to the challenges and opportunities supporting the 2020 global round of censuses through the COVID-19 pandemic. A presentation by Ms. Mitali Sen, who is a Chief Technical Assistance and Capacity Building Branch, International Program Center, Population Division, U.S. Bureau of Census. Mitali, please go ahead. You have the floor.
Thank you, Sarjan. Good morning, good afternoon, good evening to everyone. Thank you for being here. This has so far been a really informative session. My presentation is on the challenges and opportunities that we faced supporting the 2020 global round of censuses through the COVID-19 pandemic. So during this presentation, I will cover U.S. Census Bureau's International Program Center's portfolio of countries, census challenges with COVID-19, the type of assistance we provided, the challenges we encountered and the lessons we learned, opportunities that were presented during the pandemic, upcoming challenges that we see with census support, and then I will conclude my presentation. So this is a map of where International Program Center has worked. It includes countries where we have held customized workshops, regional trainings, and provided census support. The darker the shade of blue, the more recent the support. So the darkest shade is, one second, I'm sorry, I've done something with, which makes me not look. Okay, I'm going to have to speak from here. Sure. Well, I can't see the projection now. One second, I'm going to redo it. Okay. I'm not sure. Sorry, Seth, can you help me project my, I'm not sure what went wrong.
Would you like us to upload your presentation, Mitali?
Yes, yes, that would be great. I don't.
Okay, can you unshare? Okay.
One second, I'm back. Can you see?
Okay. Yes.
You can see. Okay, great. Okay, so the darker the shade of blue, the more recent the census support. So the countries in our 2020 census portfolio currently are Botswana, Djibouti, El Salvador, Ethiopia, Ghana, Kenya, Madagascar, Mali, Malawi, Mozambique, Namibia, Rwanda, Somalia, Tanzania, Uzbekistan, and Zambia. As you can see, they're mostly in the African region, with the exception of El Salvador and Uzbekistan. Now, as we heard through all these presentations, countries faced many challenges while preparing and conducting their censuses. And this is not a comprehensive list, but this is a list of challenges that the countries we worked in encountered. Firstly, disruptive census timelines. Secondly, supply chain issues, like if they were planning to order 200,000 tablets, obviously during this pandemic, the supply chain issues were quite adverse, so that was not going to happen. New fieldwork protocols for the countries that did go ahead with their census, they had to establish new fieldwork protocols. There were coverage and content errors just from disruptions in mapping, disruptions in people not being available. Office closings, many NSOs had to shut down for long periods of time and have their people work remotely. Of course, this meant in many of the countries that we work in, which are low to middle income, the internet is unstable, and so connectivity was an issue. Resource diversion, we did hear about increased budgets, but also there was resource diversion for the pandemic. So governments allocated the resources to vaccines and testing, etc. In addition, NSOs felt, experienced increased data demands because of the COVID pandemic. And so there was much more burden on the NSOs when the NSOs were not able to operate well. And sadly, finally, we have many colleagues in many countries that fell ill and some even passed away. So there was staff attrition due to illness and death. Among the type of support we were able to provide, we did a lot of remote support. So for example, we did remote census planning and budgeting assistance, remote CS Pro application development assistance, remote field manual assistance, remote assessments of statistical capacity, virtual training of trainers workshops for tool administration, remote population projection workshops. And more recently, we have done a few in-person assistance. We collaborated with UNFPA to help them with the pilot census observation in Uzbekistan. We went to Mozambique to help with the public use microsample file, and we did an edits workshop, CS Pro edits workshop in Namibia. And that's a picture we have from Uzbekistan. So challenges encountered, lessons learned. While we did several remote workshops, they were very difficult and not as effective as in-person missions. Pivoting to remote teaching meant new pedagogical strategies. And, workshop evaluations revealed that there were some minimum set of requirements to be effective. So for example, our learning materials were all for in-person. So if we didn't have the resources to redesign our learning materials, we were just not as effective. So we needed redesigned learning materials and the use of tools and portals and hubs for virtual interaction. And our tools were really not good enough to do a good job. We also needed stable broadband internet connectivity to work with these low and middle income countries. And often people were dropping off, rejoining. We would make a presentation, half the people had lost connectivity. It was very frustrating on both parts. Also, there were not enough overlapping work hours between us in the US and our counterparts in other countries. We are used to working 10 days, 8 hours a day, so 80 hours in 2 weeks. And what we were getting instead was 2 hours or 3 hours a day over 2 weeks. So there were just not enough overlapping hours because of the time zones differences. Also, there were many people participating. We found it much more difficult to get through the materials because there were many more questions, connectivity issues. And so we found that the minimum between 5 and 10 is what you need for effective remote teaching, really to build capacity. We also found that excellent communication was required between us and the team leads at the other end so that assignments could be done. And then finally, dedicated participants with few competing work priorities was important. We found that we worked with them for 3 hours and we expected them to work the rest of the day and then come back with the work they had done. And we found that they had competing priorities. And so they had not often done the work that was supposed to be done. So being remote, we were just not present and they were not present with us the whole time. So we really think that we are now at a point that we are going to have to go back and do some refresher courses in person so that we really have transferred capacity. And finally, some census operations are really difficult to teach remotely. As you heard, GIS is a big change. This global round, people are using GIS, satellite imagery, and that is one assistance we need to be there on the ground with them. And so we provided really minimal support in mapping. Now, we did have some opportunities created by the pandemic conditions. You know, our staff and us, including me, we travel a lot. So we rarely get long stretches of time to focus on developing our tools. So the pandemic allowed us this time to develop our tools. So we released a new tool for assessing statistical capacity version 2.1, which added elements to for the global 2020 round. We were able to recently release census and survey processing software CS Pro 7.7, which includes lots of mapping features, etc. We were able to release 8 technical briefs called the Select Topics in International Censuses that included notes on disclosure avoidance, included a note, we are going to include a note on how to use administrative data to supplement census data gaps. We also got to work on the demographic and population projection system DAPS that many countries use. And we are going to release a new version that's more user-friendly. And finally, we got to work on 2 new tools. One is called the tool for assessing pilot electronic census that is currently being piloted, and we were able to use it in Zambia, we were able to use it in Tanzania, and we are hoping to use it in many more countries. And then finally, another tool called the open source dissemination strategy, which is going to be available to countries so that they can do sophisticated dissemination with very simple inputs, basically using their tables, and it uses R, so it doesn't need any complex, you don't have to buy any software, and we are hoping that we can build capacity for countries to use this strategy to disseminate data and create great maps and visuals and charts and graphs of the census core topics. Another area where we had opportunities were in the regional training. We found that the savings on costs, time, and inconvenience actually allowed for more regional trainings. It also allowed us to draw from a wider pool of expertise at the US Census Bureau for instructors and presenters. Instead of sending just 2 people to teach, we were able to have many sessions with multiple experts. More countries we found could participate in workshops, webinars, seminars, just because it didn't involve travel. And finally, one very important thing about diversity and inclusion, more women could attend workshops because it didn't mean that they had to leave the home or they had to travel. Time zone differences also allowed for assistance to 2 countries in one day. So we often find ourselves, we are working with African countries in the morning and then with South and Central American countries in the afternoon. Now we do see some upcoming data challenges, especially in the area of census data edit support for countries that did the census. Those that enumerated during the pandemic, we think they may need more sophisticated methods to resolve data issues. If population temporarily migrated or got rooted during the pandemic, it may have implication for de jure counts or census coverage. Census, as you know, provides denominators for many development indicators of the SDGs that could be impacted. Population projections may be inaccurate. Master sampling frames may be impacted in the interim between this census and the next. And other content issues based on the unique pandemic conditions. We expect employment data, education data, migration data, and more to be impacted. So we see one of the challenges for us to build support is that we're going to have to build capacity to use administrative sources of data, which is a higher level of sophistication that we are used to. We are also going to have to build capacity to use population estimates or gridded population mapping in some areas. either because of conflict or that they couldn't go into those areas. Other upcoming challenges we see, as you saw in the UNFPA presentation, as the pandemic declines, all the countries are now going to simultaneously start doing their censuses. So we see a huge increased workload with our limited staff. We see more sophisticated capacity building required to resolve census data issues. And so we look forward to working with UNSD, UNFPA, and all the other international partners and countries on producing some international standards and guidelines on how to resolve data issues and make adjustments. We also see international standards and guidelines required on how to compare census data with past and future censuses from this round of censuses. In conclusion, I say on the balance, there are a lot of challenges we have to address. Future support will involve coordination among international partners so we can address these challenges in an efficient and effective manner. Building the capacity of NSOs to handle discovery, prioritization, and action on the data issues. And we're going to have to develop, I think, communities of practice and mentorship programs in order to build capacity of NSO staff to deal with data issues and quality concerns that we may have because of the pandemic. Now, these tools and online courses that we have built during the pandemic and during this time are part of the solution. And we also have to make sure that going forward for the dissemination of this round, we need robust metadata so that users understand the limitations, if any, of this data and how they were produced. With that, I thank you for your audience. Any questions? I'll open it up. Thank you.
Thank you very much, Mitali. Thank you for this really comprehensive overview of the situation that you are encountering in the field while providing technical assistance to the countries. It addresses and builds on what we have already concluded over this period of time, and it calls for decisive actions now that we are hoping that the pandemic is in the wane, and perhaps we will be able to return to the census taking in the world. Dear colleagues, I would suggest that any questions that you might have to any of these three presenters, to UNSD, UNFPA, and the US Bureau of Census, be held at this moment. I really would like to give the opportunities to Chile, Ghana, Oman, and Portugal to document how they coped with the different aspects of census taking in their respective countries. And then hopefully we will have a time to address any of the issues. Also, please be mindful of the fact that you can address any of the questions to our email address, and then we will transfer them to the colleagues for full response. It can be done later today or tomorrow, whenever you find time. So rest assured that any questions or comments that you might have will be addressed in due course. If we are not able to do them during this event. Let me now turn our attention to the national examples, and we will start with Chile. The presentation from Chile is the impact of the COVID-19 pandemic on the census in Chile and use of administrative registers. The presentations will be made by Ms. Sheila Mueller and Mr. Rodrigo Arias, both from the National Statistical Institute of Chile. Who is going to start, Sheila? Will it be you? Please go ahead, then. You have the floor.
Okay.
Wait, please. Okay. Good morning, everyone. My name is Sheila Mueller. I am the technical coordinator of the Chilean Population and Housing Census. Okay. First, I want to start with some background on the Chilean National Institute of Statistics. The Chilean National Institute of Statistics was created in 1843, and since that date, several censuses and surveys have been carried out. Today, the INE provides to the country with more than 17 indicators of topics that include employment, prices, population, and others. I would like to underline that in recent years, the use of administrative records has been promoted to improve the quality of the input that we use in surveys and census, like cartography. In fact, in the latest strategic planning priorities, the use of administrative records is very important. Okay, the pandemic has had a strong impact in all the operation in the institute, including the population and housing census. For example, the census was initially planned of the year 2022, but it was replanned given the complex situation of the pandemic, the result not only in difficult sanitary condition, but also lead the government to establish important mobility restriction. In this context, the principal impact was replanning activities. Okay, the presentation. Sorry, I don't know what happened. Okay, there. We changed the testing plan, okay? Open the census questionnaire to organization indigenous people and Afro-descendants was delayed for this problem. And on the other hand, considering the risk of contagion in face-to-face training and the limit of the number of people in closed space, we work in incorporate virtual communication during the training period in order to reinforce the content during enumeration and original planning. In this way, we could adapt to the health circumstances during the planning period. Currently, the census is planned to be held in 2023. The census will follow the traditional modality, the jure modality, and it will be carried out over 12 weeks. And consequences of the pandemic, the Institute has to apply the necessary protocols in alliance with the Ministry of Health, and also lead us to use an EQ code so the people will be able to answer the questionnaire online, the e-census also. The pandemic also presents new challenge in the cartography update that the census will use as input, and the administrative records have been a key factor. Now, Rodrigo Arianza will explain you with more details how this update is being done. Rodrigo, please go ahead.
Hello, everyone. Good morning. Let me introduce myself. I am the subordinate coordinator of the Geography Subdepartment of the National Statistics Institute of Chile. And the focused cartographic update is at now in the present census. Traditional pre-census will be replaced by a focused cartographic update process. Field data collection will be carried out during this year using mobile capture devices and will be complemented with data from administrative records in cabinet. So focus cartographic update is the cartographic verification and update process, planimetry, drillings, list of addresses and directory, carry out both in cabinet and field work, focus on urban areas, prioritize, according to its dynamism. So from the following scheme, it is important to highlight that there is a prioritization methodology that identifies the urban areas that must be updated in the field and those that will be updated in the office. The update in the office will be done with administrative records, such as the client database of sanitation companies from the country, from Chile. In the rural area, a prioritization methodology is not applied, so 100% of the territory is updated in the field. Next, please, Sheila. Next. So this is prioritization, sorry, methodology. So this concept allows to the identification of the dynamic areas between the 2017 census and the current situation in urban areas based on the marking of 14 binary variables such as new blocks and FRC incorporation is multi-purpose and versatile, allows adding or removing variables, and consider the areas of number of buildings, content, addresses, directory, plus traceability. Next, Sheila, please. So from the scheme, the 8 main inputs used to the prioritization methodology are indicated below. The inputs are that are administrative records are highlighted in red. The first 2 administrative records comes from the municipalities, and the last from the Ministry of Housing and the private foundation Un Techo para Chile. So that's it, Sheila. Thank you.
Thank you, Rodrigo. Okay. So the pandemic has led us to face important challenges in the elaboration of this census, and the use of administrative records has played a key role during this process, and we will continue being very useful. However, there is challenges in the use of this data, like to continue exploring the use of administrative records sources and allow us to development and statistic population register. In this context, during the census, we plan to measure the quality of the identification number ID, Chilean ID, provides to the population in the census, and to compare them with the civil registered statistical data. And finally, the INE must continue working in a legal framework in order to stress the statistic population register. Thank you. Very short.
Thank you very much. Thank you very much to both Sheila and Rodrigo. I think it is a clear example on how best to follow the recommendations that we are just putting in place for not only 2020 round of censuses, but beyond. I do see a hand right now from participants. I would appreciate very much that you keep your questions until we hear from all the 4 countries. And after that, I will try to give the floor to all that requires. So Mr. Daniel Macadar, please hold on until we hear from the other 3 countries. Let us now move. Thank you very much, Chile, one more time. Let us now move to Ghana. Ghana will conduct the census, and it will elaborate on the impact of COVID-19, the impact on the changes introduced in the 2021 census in Ghana due to COVID-19 pandemic. It will be presented by Mr. Johnson Owusugu Kagia, who is the Acting Director for Communication and Dissemination, Ghana Statistical Service. So, Mr. Kagia, you do have a floor. Please go ahead.
Sorry, I was trying to unmute myself. So give me a minute, please.
Certainly, please go. We can see your presentation now.
Okay. Thank you so much. And thank you for the opportunity for Ghana to share her experience in conducting the census. And as you rightly pointed out, we conducted our census June last year. And so we share with you in the next 10 minutes, 15 minutes or so on the changes introduced in the processes due to COVID-19. So this will be the outline of the presentation. And so as the background, let me say that Ghana has conducted 12 censuses in almost every 10 years since 1891. But then it was after our independence in 1960 that we started conducting modern censuses. And so,
Mr. Kaya,
hello.
Sorry to interrupt. You are still on just the first slide. Your slides are not moving. Are you moving them?
Yes, is it moving?
We are still, we still see only the first slide.
I'm moving my slide, but I don't know. Let me unshare and share again, please.
Maybe if you run the presentation, if you click on run, maybe it will help.
Please, do you see it moving?
And no, we are still on the first slide.
So can I unshare from here so you share from your end, maybe?
Yes, safe. Do we have Mr. Kagia's presentation?
Yes, we do.
Very well. So then we will run it, Mr. Kagia, and then you just tell us when to move the slides.
Okay.
Oh, now it's moving.
It's moving now?
Well, yes, but then we'll do it from our side, just to make sure that this is going well. Safe, please upload yours.
Okay. Thank you so much. So I'll just give you a background of our censuses I'm undertaking in Ghana, and was saying that we have conducted 12 censuses since 1891, but then it was after our independence in 1960 that we started conducting modern censuses. And so the 1960, 70, 84, 2000, 2010, and the last one, 2021, happened to be modern censuses. And we started combining population census and housing census in one operation since 2000. And so population and housing censuses have been conducted in 2000, in 2010, and the last census 2021. And the last census 2021 has been christened as Ye Census because we use a lot of technology in conducting this census. And our goal in conducting this census was in twofold: to have a complete coverage and to have quality census data. Please, next slide. Yeah, so these were our initial plans for the 2021 census before the COVID. Fortunately for us, we had finished with field work for cartographic mapping. And so at the time of the COVID, we were working on the map production and the office work as far as the census mapping is concerned. We had planned to do recruitment of full staff using online application and also doing in-person screening to be sure that we're getting the right persons to get involved. For training, we had planned to do only in-person training. And for data collection, we had also planned to do in-person face-to-face data collection. Again, the plan was that we do 7 days. So the field work were in 2 phases. The first phase was the listing of households. And the second phase was the enumeration of the households. And so we had planned to do 7 days of listing and 14 days of enumeration. Next slide, please. Yes, and then COVID reared its head, and so plans had to change. So we had planned to do our census in March 2020 per the Statistical Service Act. But then because of the COVID, there was a number of restrictions in a number of areas, and so we had to postpone the census. And so the postponement came with a mixed impact. Mixed impact in the sense that it put, first of all, a burden on us. So because of the postponement, we required additional resources. And then we had to modify our instruments, the questionnaires, even though it was not changed, but the strategies that we had planned with, going into the census had to be modified. And so this put a kind of burden on us. We had to buy additional PPEs, We had to increase the number of classrooms. And so I will talk more details into that. And at the same time, even though it put burden on us, we also say that it brought some kind of benefit, a huge benefit. Benefit in the sense that at the time, we were still battling to get our tablets. And so then the postponement gave us an extended time to make sure that we got all our tablets that we needed. We needed about 75,000 tablets, but at the time we had just around 20,000 tablets. And so there was a shortage that we needed to get. And so the postponement helped in that sense. And then also at the time, as I indicated, even though we had finished with map field work, we were still working on the office work as far as map production is concerned. And so the postponement gave us enough time to work on these areas. In the areas of ISCO ISIC, we were still grappling with how we should present this to our trainees in order that they'll be able to appreciate it better. And so we hadn't concluded on the best way, because this is a difficult area. And so we wanted to have a simplified way of presenting this to make sure that we get the quality data from the field. Please, next slide. Yes, so after the COVID, as I indicated earlier, we needed to do a lot of changes in our plans. So talking about recruitment and training, we stuck to the online recruitment processes, and we did in-person screening, but then we were mindful of the fact that we had to make sure that the social distancing and, participants were always wearing their masks and all that were also adhered to. In terms of training, we had to adopt a hybrid of training method. And so, as I indicated before the COVID, we were only doing face-to-face training. But after the COVID, we had to introduce virtual self-learning, where we had to give the materials to participants to learn on their own. And then also we engage them virtually on some of the modules. So for some of the modules, it was easy engaging the participants online. And so we selected some of the topics that we felt that we could do that through online process. But for those those topics that were difficult to teach online, we did that during the face-to-face training engagement. We also engaged, technical working groups virtually. Our regional staff and district teams that we had to collaborate with were also being engaged through virtual means. At the time of the data collection, we did face-to-face. There was no way we could do this online because we are not, we haven't developed to that extent to do online data collection as far as census is concerned. And so we stuck to our plan of doing face-to-face. But then, as I indicated, we needed to make sure that the field workers are wearing their mask. We also made sure that they adhere to the 2-meter social distances between individuals as the government was monitoring these activities, and also making sure that we give sanitizers to the field workers. As a result of that, the duration of the training was extended. So that was one of the impacts that we saw. Because of the hybrid nature of the training, the number of days that we had planned to do had to be extended. It also affected the field work in some sense, and so we had to do mop up after the 14th day that we had planned with. So we went beyond the 14 days. We had to do a lot of publicity to make sure that people get an understanding of what benefits that we are going to get out of the census. Please, next slide. Yeah, so the question that we're asking is, should we reduce the number of questions? So from our end, looking at the importance of the data and the benefit that we're getting from the census data, we decided not to change the census instruments. And so the amount of information that we collected remained the same. However, as I said, a number of things had to be done to make sure that we were getting the complete coverage that I talked about, and at the same time achieving the objective of getting quality data from the field. Because if we did 14 days of enumeration or less than 14 days of enumeration, what it means is that we're going to reduce the number of days of enumeration. But then because we have stuck to that, we had to do a lot of publicity to make sure that we get what we anticipated. Because of the COVID, there were a lot of hesitancy from some people, and that is why we have to deepen publicity, education, and advocacy to raise public awareness of the importance of the census, to make sure that we achieved our goal. And as I indicated, we gave PPEs and also trained people on maintaining the social distances to make sure that we get what is required. Then one of the things that we did as a result was to use a tracking dashboard for real-time data checks. And so we wanted to be sure that we're getting the right information, the quality data from the field. And so the dashboard enabled us to track on a real-time basis as to whether we are getting the numbers, and where we're not getting responses from the field, we drew attention of the supervisors and monitors to quickly go to the ground and check what is happening, whether it was due to sinking issue or some other factor. We also set up a data quality monitoring team where before people left the field, they do consistency checks and edit checks to make sure that where they find errors in the data that were coming, we drew attention of the field data collectors to go back and correct whatever errors that were emanating. Please, next slide. Yeah, so concluding, we're saying that even though the pandemic brought its own challenges for us, it did not affect us so much in terms of the data that we were collecting from the field. However, we think that these are areas that additional guidance should be given to support respondents in answering the questions in order that we get quality data from the field. On migration information, we realized that there were a lot of movements, and because we were using the de facto method, if we don't ask the question properly, we're going to get responses that were at variance with what our expectations are. And so we think that these are areas that we need to guide by explaining to the understanding of the respondents to be able to elicit the right response. If you take economic activities, again, because we were looking at the main economic activity engaging by the respondents, it was very, very necessary that we give clarity to respondents as to what we needed from here. And when it comes to fertility and mortality data, again, we're looking at the, if it comes to fertility, we are looking at the own biological children of our female respondents. And so a lot of clarity had to be given here to make sure that you get quality data from the field. And as for mortality, the confusion is what kind of information you need. And here our focus was on the deaths that were occurring in the last 12 months within households. And so if clarity is not given here, people will go even beyond the bounds of the household, and also will move away from the 12-month period that we had given ourselves. And so these are areas that we think that additional guidance should be given in order that we keep to the quality of data that we're getting from the field. So, Chair, I end here in my presentation, and thank you once again. And if there are questions, I'll be glad to respond to them. Thank you.
Thank you very much, Mr. Kagia. Thank you for for describing the process that Ghana Statistical Service undertook in order to make sure that the census has been successfully conducted, and congratulations to the success. We are also taking note of your point that postponement also provides an opportunity and has its benefits in order to refine the tools for the enumeration and fill in the necessary methodological and operational gaps. So thank you very much for this presentation and for an example of having the census taken during the pandemic and the adjustments that you have had to undertake in order to achieve that. I'm quite sure that there will be follow-ups and lessons learned from your experience as we move on throughout the 2020 census decade. Let us now turn our attention to the e-census 2020 and impact of the COVID-19 pandemic in Oman. And the presentation will be made by Yusuf Al-Riyami, the General Director of National Statistics and National Center for Statistics of the Sultanate of Oman. Mr. Al-Riyami, you have the floor. Please go ahead.
Thank you so much, Sajan, and happy to be in this session. And our high appreciate to be in this session as well. And hopefully, inshallah, next year we'll be physically in New York in all session of the Commission's 54, inshallah. So let me start just a short introduction before I give this floor to Mr. Malik also, because he's a technical in the Census 2020. In general, Oman, during the pandemic, of course, they keep working in the statistical national statistic at the time. All the schedules, I mean, indicators, and also the monthly bulletin was running at the same time. Yes, there is some impact for the pandemic, but we could, using the technical, we're using the administrative data, we could pass for this project. I have 15 minutes only. Just I will give the floor to Mr. Malik to give his presentation about the census, the technical things in the e-census 2020, also some regulation we use in that project. Malik, the floor for you. Thank you.
Hello everyone. I will talk about e-census 2020 in Sultanate of Oman. The content of my presentation will be I have 5 subjects. You can see the presentation. Everything is fine.
Yes, we can see.
Okay. My topics, it will be the legal framework, objectives, the main phase of the census, sharing during the pandemic, and data system. First of all, here I want to confirm the Oman 2020 census was administrative data sources 100% in the 3 topics: population, housing, and establishment, and we don't have any or zero. We have 0 field visits. Legal framework: the royal decree in 2015 was the framework of Oman census that to provide an updated and special economic and social information through an electronic data system. In the census, we have 4 committee, the Supreme which was the committee member was from all ministries, agency, minister, all related minister agency, and technical committee. Also, the chairman of this committee was the CEO of NCSI, and the committee member was all data source agency. Also, we have media committee and executive management. In the executive management, we have project management office, also experts, data, statistics, and labs. We have information system, media, and identifier. Also, we have specific working team, technical team in each data source. The e-Census 2020 aims to disseminate statistics and indicators by the end of 2020. Therefore, provide decision maker with the timely and current data. This data will include all information related to population, housing, and establishment. This objective will be achieved by implementing the following high-quality national database and integrated and electronic linking data register. The actual work for the census was started in 2017. We had here I will talk about the main phases in the census. The first phase was to study the identities data system and how collecting and updating the data in the each identities data source. And also this was from 2017 up to 2018, and also we have another phases from 2017 up to 2019, which is studying the data business. Also, we have another up to 2019 preparing methodologies for create statistical database. All these phases was before the pandemic. Here we have a phase to determine system input and output and cross tables between classification and administrative classification and statistical classification in the systems. Here, the pandemic is starting through the building the system, but at the end of this phase, and linking with the identities, also here the pandemic is starting in this phase. We have in 2020, we testing the system and the portal data for the e-Census. Here in this stage, we are elaborate a pilot census, which is quarter census through the 2020, and the result of the census was in December 2020, and we take the snapshot from the administrative data system on the time which is defined before in the planning, and we don't have any delay in our census, and we publish our data in 14 December 2020 after 48 hours. The challenge through the COVID pandemic in Oman, the first infection was in the end of the February, and at the end of the March, the government reduced the employee in the office up to 30%. That time we are already finished the second pilot or testing for the e-Census 2020. And also the infection was not high, as you can see in the graph. The highest infection was in July. In that time, we are already finished the third pilot also census. Here I can summarize the challenge during the COVID pandemic. We already finished the first, second, and third phases, and we already started the fourth phases before the COVID. Also, we already elaborated 2 pilot sensors. E-census team was only 71 employee, and we all working from office. We don't visit the field, and we are distributed in different labs. We have 5 labs and another office also. The 5 labs was in different places that we are away from together, and we don't stop the census work through the pandemic, and only we work 2 weeks from a home. The challenge was the integration only. We finished already the main sources which is linking to the system. Not all, we have delay in adding complementary source or secondary source not linking to the data census customized file. We bring this data in as offline. It's not voluntary files like health center visit and like another secondary sources in the data national system. Also, we delight in the optimize of ETLs to take the snapshot in our system. And it takes about 4 hours. We are trying to reduce this times, but because the pandemic, we don't finish this optimization. Here I will talk about data system in Oman. In the data system, national data system in Oman, we have 4 database to transformation the data through ETLs. Here I will summarize the 4th database. The first database was agency database, which is collecting and uploading data. This uploading by linking or by offline files. Linking data is for the main and voluntary files, and secondary files is by offline files. Here we apply technical standard rules and linking the geographical data and sorting error of records. This error we can report the source, each source, and give us reporting about the data in the e-census project. The second database is integrated database, which is linking database and adding relation tables. In this data, we are applying logical rules, sorting also the error of records. We have another data, which is anonymizing database, data encryption. Here, up to this database, we have an on-time updating for the data. And in ETL force, we take the snapshots in the reference date, which is defined from the National Statistical Center of Oman. Here we applying statistical methodology in this statistical database. We sorting and updating result, temporal dimension, and update border indicators. Here the result of our census for the population, establishment, and units, which is housing units. So thank you, and I will give the floor for any comments and questions. Thank you very much.
Thank you. Thank you very much. Thank you very much to both Mr. Al-Riyami and to Mr. Malik for this presentation. It is indeed an outstanding example on how when you established the register-based systems, even the pandemic has minimal impact on the production of granular census-like small area statistics. And thank you very much for this example. I believe it represents indeed a lesson to all of us on how best to take advantage of the existence of administrative sources. Let us now please move to the
You are muted, Surgeon.
I'm sorry, can you hear me now? I believe you do.
Yes, we
Okay.
can.
Yes.
We can.
Very well. Sorry about that. Let us then move. Thank you again, Oman, for this presentation. We are moving to Portugal and the experience of 2021 census in Portugal. It will be delivered by Mr. Almilo Miguel dos Santos Rodrigues Moreira, who is the Deputy Director of Data Collection and Management Department, and Ms. Paula Paulinho, who is the Census Unit Coordinator, Statistics Portugal. Portugal, would you please take the floor?
Thank you. I will share our presentation. Sorry, just a moment, please.
Mm-hmm. Of course, of course.
Are you seeing our my screen?
Yes, yes.
Thank you.
Okay.
Okay, thank you. Good morning, good afternoon, or good evening. I would like to thank the invitation to share the Portuguese experience in 2021 census. My name is Paula Paulino, and I'm coordinator of the Census Unit in Statistics Portugal, and I will share this presentation with my colleague Almiro Moreira, who is Deputy Director of Data Collection and Management Department and was the National Coordinator of the 2021 Census collection. We will present some features of the Portuguese 2021 census and the adjustments made relating to COVID-19. Our presentation will focus on 4 main points: the 2021 census program, the contingency plan developed for the COVID-19 pandemic, the strategy for data collection, and finally, some data collection results. The 2021 census was conducted between April and June of 2021 in a pandemic context through an entire population survey using a digital information collection process. The preparation of the Census 2021 started in 2017, and since the beginning, the strategy for the 2021 census was based on these 4 areas of innovation: the utilization of an address list, and for the first time in the Portuguese census, the traditional process of door-to-door questionnaires distribution was replaced by the delivery of a letter with necessary information to response through internet. The second aspect is the internet as the main channel to respond to census. The internet data collection was introduced in the census for the first time in 2011 with great success. The response rate was in 2011 about 50%. For 2021, the intention was to achieve a significant increase in the response rate. A winning strategy, as we will see later in this presentation. Then the third aspect is the reinforcement of the technology in the fieldwork. For the 2021 census, it was developed a specific app for enumerators where they could do all the tasks relating to 2021 census collection. My colleague Almiro will present the main aspects of this app. All the field work was made through mobile devices, and we used the strategy of bring your own devices. The majority of mobile devices belong to enumerators. The last area of modernization was the use of administrative data who have an important role in monitoring the fieldwork and the data validation process. All census program was focused on two main strategic goals: a digital census with a digital data collection and a digital fieldwork, and an inclusive census where all counts and where we have to count on all. The COVID-19 pandemic had a significant impact on the preparation of the 2021 census and the overall statistics Portugal activity. The census program included a pilot survey that was planned to April 2020, 1 year before the real operation. Due to the COVID-19 lockdown, in March of 2020, all the fieldwork activities in the statistical operations was suspended for health reasons, and the Census 2021 pilot survey was cancelled. With the pilot survey suspended, the evaluation of a change in the schedule of the Census 2021 was deeply analyzed. Statistics Council, through the section for 2021 census, which is the body responsible for advise Statistics Portugal, recommend that Statistics Portugal study all the possibilities for conduct census operation in 2021, or if not possible at all, to prepare a postpone plan for 2022. Statistics Portugal look for the alternatives that would allow maintaining the operation in 2021 and finding ways to mitigate the risks that the operation implies in the current epidemiological context. For Statistics Portugal, was essential to ensure the availability of quality information to respond to the needs of the Portuguese society, but also to respond to European compromises. Census 2021 execution comes after a rigorous analysis and viability study with the definition of a contingency plan in order to guarantee the census quality and to prevent risks for population and for census workers. Well, in Portugal, the census program was adjusted to COVID-19 pandemic situation to ensure that Census 2021 was conducted in a safe and a secure way. A contingency plan was defined with implications in several dimensions of the census operation. The main factors of the contingency plan was the replacement of the pilot survey for a smaller test that was conducted in November 2020. This test was the last stage of the preparation for the 2021 census, and its goal was to test the collection process that supports the census operation. This test has already carried out in COVID-19 epidemiologic context and according to the guidelines issued by the health authorities. It was like a proof that census was possible in a pandemic context. Then we have the other measures, like the definition of a public health protocol and some adaptations to the collection modes that I will talk right now. Another aspect was the definition of a public health protocol with cooperation of the health authorities. All procedures to ensure to minimize face-to-face contacts was applied. The utilization of personal protective equipment like facial masks and alcohol solutions. The recruitment and training sessions were carried out using video conference systems. Letters for response was delivered in mailbox instead of being delivered by hand. Enumerators observe physical distance and the meetings between the teams was by video conference, and contacts was with the telephone and by email. Another big task was to reinforce the option for web collection. This is one of our image of our web questionnaire, and the internet option is the safest mode to collect information from 2021 census. The internet response is easy, safe, and fast, and that was the message that we passed to the population. Another fundamental measure to adjust census operations to COVID-19 situation was the introduction of answers by telephone. There was a need to add this additional mode to complement the internet option. This option was essentially to population groups that will have greater difficulty in response via internet or with no possibility to contact to face-to-face enumerators. This is not initially foreseen, but it was a needed new method. Another feature was to reinforce the helpline to assure the population. Oh, sorry, the population. The helpline was designed to respond to an epidemiological context with high restrictions on face-to-face support. Then the contingency plan also provides adjustments in the communication and in the publicity campaign, adaptation of the message about the internet response, and one more time, answer online is safe in both ways. We also develop and explore partnerships with all sectors of the society in order to make the census a special project in a special time and with special conditions. Then the last measure related to the contingency plan was the administrative data support. The contingency plan also reinforced the importance of administrative data in 2021 census that was even more relevant in the context of COVID-19. The administrative data was important to improve the quality of the address list through the integration of administrative information and updating the occupation status of dwellings, fundamental aspects to increase the effectiveness of the fieldwork. Then the administrative data was also important to improve the population count by making available population estimates used as warning indicators in the control of the fieldwork. We had a so-called alert indicator system that consists of monitoring in time counts of persons and dwellings by comparing the results of the collection with expected values obtained from administrative data. The administrative data was also important to reinforce data validation process and data consistency analysis, including the possibility of non-response imputation. Being part of the contingency plan, administrative data was prepared to assist eventual contingency actions for different adversities that may comprise the census response. The possibility of having a set of administrative data that characterize the population, if in certain areas or in certain households it was not possible to collect data through the census process, was a possibility. Fortunately, the pandemic was not so bad in April, and then this Plan B was not necessary. I now pass the floor to my colleague Almiro Moreira, that will talk about data collection process and data collection results. Sorry, I will stop sharing. Please, Almiro.
Okay. Share. Are you seeing my presentation?
Yes, yes, please go ahead.
Yes.
Okay. So thank you very much for this opportunity. My colleague already presented me, so I work in the data collection program department, and I was the responsible national responsible for the data collection from Census 2021. I will give you a very quick overview about our field work and our data collection schedule. So as you see in this figure, we start in April, and we finish around the end of the June. Also, we split our field work in 3 phases that I will show you in the next slides. A quick overview about our data collection team. We involved around 50,000 staff members, including 11,000 of enumerators who were involved. And we have 3 decisions levels: national, regional, and local. We also have technical support line is outsourcing, and we had about 3,000 parish support desks. That was a mix of staff from the parish, and also the enumerators support these parish support desks. So in phase 1, we start from 5 April to 18, and all dwellings receive a letter with a unique code and password to answer by internet or telephone. These letters were distributed by the enumerators without any personal contact with the population because the COVID situation. In these phases, enumerators also made the housing census, confirm and correct addresses, add new buildings, delete no-existing buildings, and fill in the housing census questionnaire. No paper questionnaires were distributed to the population. So in April 18, we end our distribution 2 weeks, and our enumerators delivered 6.2 million of letters. It's around 99.2% of the population with a letter to respond by internet. The letter look like in your figure, and you can show this unique code and password for each dwelling. And then the phase 2 is the replay phase. It's from 19 April to end of June, and the web questionnaire was available to reply from 19th of April. It was the census day, and we recommend to the population and our campaign and our publicity to the population's reply preferably by 3rd of May. As I said, we communicate to the population to respond until 3rd of May, and we had a great cooperation by Portuguese population. And in only 2 weeks, we have 6.6 million of dwelling with the replies, what correspond to 9.4 million people registered, and this is 90% of our population. So, like I said, due to this fantastic adhesion of the resident population in Portugal, we anticipate the remand letters by 3 weeks, from the end of May to the 4th of May. This is the reminder letters looks like, and it was delivered by the enumerators in the box in the each dwelling. So in the next phase, phase 3, it's the phase of conclusion, and we prepare this phase until the end of June, and with some microdata analysis that we made from the data we collect, and also collect the missing answers. In the end, we closed the questionnaire on the 20th of July. The questionnaire was available until the end of the data collection. Here, some notes about our tools that we used in this data collection census. So as Paula talked before, we had this app, the enumerator, if I translate it for English, and this app, it's the principal tool for the enumerators. It's installed on their own devices and work in iOS and Android. So this app allows to the enumerators associate the letters and the code for each dwelling, made the georeferencing buildings, list all buildings and dwellings to make the census, add new buildings and dwellings, correct buildings and dwellings data, schedule appointments with the population, synchronize data when it was collected offline, and receive message from the data collection structures. This message that we could send to the enumerators was very helpful, because we can always communicate with our enumerators. This is how look like the screens to the geographic referencing buildings, and also to correct the geo position. Like we can see here with this pin, we can adjust the correct geo position of each building. Also, the enumerator, this app, give always online and on time the status of each dwelling. It also have a lot of action buttons, and they are adapted to the state of response, and they are always shown in the smartphone of the enumerators, and you could do a lot of tasks that we prepared. And also we also have a back office tool with a status report, microdata analysis report, allocation of geographical areas of work, recruitment and payment system, and the access of this tool is according to staff member profiles. And to finish, as we already had some questions, this is how we split our response mode. So 99.31% of our replies was made in electronic reply. Also, only 0.2041 was in paper and 0.28 in telephone. Then if we split the electronic replies, we have 88.08% that was answered directly in our form in the internet, and then 7.77% was collected in the app that I showed before, and 4.15% was collected in the parish support teams in the as we called Balkan. As you can see, And like I said in the few slides in my presentation, we have a big number of replies in the very first days. So is what we have to show. Any questions? Obrigado.
Thank you very much, obrigado, Portugal. Thank you very much for this presentation, and I believe it illustrates extremely well the possibilities that are at the disposal for census taking, given the circumstances when the pandemic is actually endangering the traditional way of census data collection. I realize that we are beyond the scheduled time for this side event of the Statistical Commission. Let me just try to summarize in 2 words what we have heard today, and I believe this is really a kind of document of census taking during the pandemic. We have heard from 2 countries, from Ghana and from Portugal, how they adapted to the pandemic and then adjusted their procedures. Portugal relying on internet, and then Ghana relying on the time for postponement to make sure that the preparatory activities are being taken in a more consistent manner. We have heard about the way that countries are thinking about census taking in the future and how Chile is preparing to put together the statistical population register. And then we heard from a country, Oman, that established the register-based production of census-like small area statistics, therefore minimizing the impact of the pandemic for the success of the census activities. We have also heard of the activities at the international level and the national level that are undertaken. We hope and we are completely sure that this side event will provide additional food for thought for the delegates of the forthcoming Statistical Commission, and the results that we have heard here illustrate extremely well the momentum that we are having in terms of implementing the 2020 World Population and Housing Census Program. I thank sincerely to all of the participants. We did have received a number of queries, and then some of them have been answered either through the presentation or through the chat box. Please do not hesitate sending us any queries you might have. We will make sure to channel them to the presenters, and you will receive the responses. I believe that we have to learn from each other. The lessons that we have heard today are extremely valuable for all of us, and they simply illustrate the resilience of our colleagues worldwide and the solutions that are available to all of us that we need to consider as we move on towards the end of the 2020 round of population housing censuses. So on behalf of all of us here at UNSD, thank you sincerely very much for this, I would say, extremely comprehensive overview of the census taking in the world. And let us hope that these lessons will be used by the colleagues worldwide. Thank you, goodbye, and all the best.